everybody. This is Ted. Ted's here in my office with me today. Ooh, Ted, you got me all slobbery. My boy. I wanted to talk to you a little bit because I posted a video yesterday from WTNH about my breast cancer diagnosis, and I wanted to kind of give a little bit more to the story because we talk so much about lumpectomies and mastectomies, and a lot of people came up to me after that video and asked me why I was so drastic with the surgery that I did, because I had a really early breast cancer, and it's really a curable breast cancer, thank God. And the way I knew I had it was because I did my screening mammogram, and they found it early. So by doing a bilateral mastectomy, I'm pretty confident that I'm cured of the disease without doing any other medical treatment, which is really nice for me, and I feel very fortunate, and I don't know why I was the lucky person, but I have a lot to be grateful for. And what I really want to get out of it, because it changes you when you have this kind of diagnosis, for that 5 minutes of time where you're wondering if you're going to live or die, you start asking yourself really important questions, and some of those questions become, have I lived life right, and what am I here for? You know, you get very philosophical in those hours when you don't know. So what is the reason why this has happened to me, and what is the reason why I was so lucky to have found out early? And I think the answer to that question is that I got to help people now, and I have the great good fortune of having a great deal of knowledge about breast cancer because I've treated hundreds of breast cancer patients and have reconstructed hundreds of women who have suffered with this disease. And now I'm a woman who's had this disease, so I think I have a really unique perspective. And what do I want to do out of that? The first thing I want to do is I'm putting together a support group. So we're going to be meeting once a month in my office, and I'm actually going away for the second stage of my reconstruction in 2 weeks. But when I get back, we're going to have our first meeting probably about 2 weeks after. I'm going to let you all know when it is. It's kind of going to depend on how I'm feeling at that point, but usually I'm pretty good. The mastectomy, I was back after 2 weeks, so I suspect that it won't be much longer for the second stage, which is a lot smaller operation. But what I want to get across is that there's a lot of trends with breast surgery that have gone to minimally invasive things like lumpectomies and radiations. And why did I choose something that was so much more aggressive? And here's the reason. I see the patient who comes back with local recurrence, and I see them going through chemotherapy the second time after they've cured the cancer once before. And I know the emotional angst that happens to women when they've gone from a curable form of a cancer to one that's potentially life-threatening. I see the ladies who have done lumpectomies and have had radiation on their breast and what it does to the tissue when you try to reconstruct them. I see what the medications like tamoxifen do to you with depression and brittle bones and weight gain. And if it meant that I was going to have a more aggressive surgical approach to avoid all of those things, that's what I was going to choose. And that's the other side of the story. So the side that's really presented most commonly is that the survival rate for lumpectomy and mastectomy is the same, and it is. But the fine print below that statement is that the local recurrence rate's not the same. So if you have a lumpectomy, your local recurrence rate with radiation is 4%. If you have a mastectomy, your local recurrence rate is 1%. So that's 4 times higher local recurrence rate. Now stretch that out over I'm a 44-year-old woman, stretch that out over another 20 to 40 years of life, that becomes a significant number. And I didn't want to see this disease again. I want that 1%. Radiation, it changes your tissue forever. It affects your heart. It could affect your lungs. All of those things are true. And then if you are one of those people who gets a local recurrence, your reconstruction options are so much more limited than they were if you just took everything off as a primary operation. So I always thought these things, and I thought, oh, I have a bias against it, and it's not rational because the data doesn't support me, whatever it is. So I went to a group of ladies in plastic surgery. I have a website group that I talk to other women in the field, and I told them I have DCIS, a ductal carcinoma in situ. I'm a poster child for a lumpectomy with radiation. What would you ladies do? And 50 ladies answered me, all plastic surgeons who do breast reconstruction, and 48 out of those 50 said that they would get a bilateral mastectomy with reconstruction. And it begs the question, why are we telling our patients to do something that the vast majority of us would not do for ourselves? And that's what I want you guys to ask yourself too, because you need to get the whole story. And what that means is just having the conversation with somebody like me. And that's why I want you to be able to come and talk to me if you are an unfortunate member of this club that I've been thrust into. And I'm happy to talk to you, even if I'm not the person doing your reconstruction. I will be your advocate, and I'll find you the best avenue to get the treatment that you need. And I think the best way to do that is through these support groups. So my goal is to get them going once a month, and hopefully I'll get enough people. I think having a group of ladies who have had the same situation, all able to talk to each other, is nice in and of itself. But in addition to that, you got me to be able to tell you where to go, what to do. I'm not going to tell you what to do. Ultimately, it's your choice, but I'm going to give you the information, and I'm going to give it to you straight. So that's what I'm offering you, and stay tuned, because I'm happy to do it, and it helps me more than anything else. So
we have a lot of people coming in right now saying that you look fantastic.
Oh, thank you.
And that you look gorgeous.
Oh, gosh.
It's the truth.
You're very sweet. Any questions for me?
Yeah, if anybody has any questions, you can shoot them out.
Might sign out if I don't get any questions. But it's my pledge. When I get back from surgery, I'll be back. My surgery's on November 15th. I'm going back down to Michigan to Dr. Dennis Hammond, who is a complete artist. The man is wonderful. And when I get back, we're going to put something together.
Sally Dwyer says she can't wait to see you.
Hi, Sally. All right, ladies and gentlemen. Great talking to you, and I'll see you soon.